Good morning, welcome back. A new study finds that cervical cancer is a bigger threat to women than people realize. Joining us this morning to help us understand this new study from Gundersen Health System is Dr. Lori Weinberg. Dr. Lori Weinberg, thanks for being here this morning.
No problem. Thank you for having me.
So the new study is bringing some new findings to Gundersen. Will you tell us about those?
Well, what we found in this study is that when we account for women who've had a hysterectomy in the past, the disparity between African American women and white women in regards to cervical cancer deaths is actually much greater. We thought we were closing the gap previously, but it turns out the rates are much higher among black women in regards to death from cervical cancers.
Okay, is there any reasoning behind this higher rate with black women?
Well, it's believed that it has a lot to do with women's access to health care, access to getting their routine pap smears, routine HPV tests done, which we know are very, very good at preventing cervical cancer and death from cervical cancer. But women who aren't getting their routine screening, we know that they're usually diagnosed with their cervical cancers at a much higher stage, which unfortunately are not as curable.
Okay, so definitely early screenings, early prevention is the key for this. And we're learning more and more that the younger women, it's vital for these HPV shots. You know, when should we be starting to talk to our doctors, our daughters as well about this?
Well, actually, HPV vaccinations can start at a very young age, as early as 9 years old, and usually this is done as routine parts of pediatric care when girls and sometimes even boys are coming in to see their pediatricians, because this can actually prevent them from even getting HPV, which we know is the cause for cervical cancer.
Okay, and definitely keeping up with those vaccinations as well. I mean, I believe there's 3 over a period of time, so you have to make sure you keep following up.
Correct. Correct. It's not just a one-time shot. There are a couple that you have to have done. 3 shots is the total series, but it's extremely effective at decreasing the chances of getting high-risk HPV, which causes cervical cancer, and can even decrease the risk of developing warts, which is also beneficial for people as well.
Okay, so definitely getting that HPV vaccination is the main preventative measure, you're saying?
Well, yes, the vaccination is preventative, but also the routine screening for the pap smears and HPV testing is also very beneficial for the women who haven't been vaccinated and are still at risk. And unfortunately, for a lot of black women, we see that they're not getting their routine screening because of no access or no health care that they have, which puts them, unfortunately, at a high risk for getting cancer and dying from their cancer.
Okay, so definitely those screenings as well, you know, taking care of yourself, #1 priority, especially for women. Dr. Weinberg, that's all the time we have this morning. Thank you so much for joining us.
Thank you. Thank you so much.